my name is Michelle Morgan, and I am performing my assessment for the head, nose, ears, and throat, as well as the chest, respiratory, and heart sounds. I'm going to wash my hands. And, hi, Mr. Morgan. My name is Michelle.
Hello.
I'm going to be doing your examination today. Okay. First, I'm going to start off, and I'm just going to do a general assessment and looking at his appearance. That he's well dressed, that he is alert and oriented ×3. He knows who he is and where he's at and all of that. And then I'm just going to do a general assessment of his skin. I'm just going to be looking over it, making sure that the turgor is nice, making sure that there's no open lesions on his skin, or there's no breakdown or anything like that. And just just doing a general check and over that it's in good general health. And then I'm going to move to the head assessment. One of the first things we're going to do is I'm just going to look at his head, and I'm going to put my fingers all over his head here. What I'm feeling for is I'm feeling for general skin condition, which is nice and moist, the way it should be, its normal findings, as well as I am looking for any irregularities within his skull area. Just making sure there's no abnormalities, no raised areas, anything like that. And then I'm going to move down, and I'm going to move to just his facial bones here. I'm just going to be checking and palpating around the area here, just making sure everything looks symmetrical. I'm going to check his jawline. If you could open and close your jaw for me. I'm looking for TMJ, which is when that is present, you can feel a pop within the joint of the area, which he does not have. And then I'm going to look at his neck, and I'm looking for symmetry all the way down. I'm looking at his tracheal line, just to make sure that that is all symmetrical and that everything is all even. I'm also going to check his sinuses, and I'm just going to palpate around the areas here. Make sure that there's no swelling or any abnormalities, feeling any masses or anything like that. And then I'm just going to check his eyes. On the last assessment, we checked his pupil dilation and movement and everything. So on this one, I'm just going to be checking his sclera of his eyes, his conjunctiva. I'm looking for any kind of unusual discharges. I am making sure that they are moist, that the trigger around the skin is good, and that everything is symmetrical, which he is all normal. Then I'm going to move to his nasal, and I'm just going to be looking at his nasal bones around the face, making sure that it's symmetrical. I'm looking at his septum here and his nose line here to make sure that is. I'm also looking at the whether it's moist, whether it's the trigger is good and everything. And then if you look up for me, I'm just going to look into his nasal passageway and just make sure that I'm not seeing anything that's deviated, like a deviated septum or anything like that. And then I'm just going to have him breathe through each nostril so I can assess that. So if you can take a deep breath. On the other side, please. Very good. And then next I'm going to check his mouth. And have you open your mouth for me. Stick out your tongue. Stick it out far, and then say ah.
Ah.
And what I'm looking for is I'm looking at his uvula and making sure it's midline. Can you say ah again? And open wide. I'm also looking for his tonsils. The rating on tonsils is from 0 to 4, 4 being that they're kissing tonsils and they're very large. His appear normal, I would say probably within the 1 to 2 range. And the next, I'm going to move to his ears. If I had an otoscope, I would be checking on the interior of his ears and just assessing that everything looks normal and in alignment. On the outside, I'm checking the mandible area. I'm checking for any malformalities. Again, I'm checking symmetry of the ears and if there's any kind of masses or anything there. Okay, which all looks normal. Then I'm going to move to his chest. And what we're going to be assessing in his chest is first I'm going to have him take some deep breaths for me. I'm going to be looking for symmetry, making sure that the chest is rising and falling normally, and that he's not using any accessory muscles. So if you wouldn't mind taking a few deep breaths for me. And again, please. Very good. And then I'm going to just be palpating. Again, making sure there's no abnormalities. If you could sit forward. Now I'm just palpating the different areas going from side to side of the lung fields. And then after that, I'll percuss. Again, just looking for abnormalities. And then I'm going to take a listen to his lungs. When listening to lungs, you always want to try to, if you can, listen from the back, because that's where your best hearing is going to be of the lung fields. If you have a patient that is unable to, then you can listen from the front, but it is not your best area. Take a deep breath for me. Again. And as you get lower, you can hear the vesicles. Okay. And then I'll also take a listen from the front. Deep breath. And again. Okay. And then I'm going to go back to his neck area here. I did not palpate for his lymph in his lymph area, so we're going to check that real quick. Now what we're going to be looking for here is I'm looking for any kind of abnormalities again. I'm looking for swelling. I'm looking for unusual feelings. So I am palpating the prearticular and the postarticular, the tonsillar, the submandible, and the mandibular. I'm also palpating the submental, the arterial, and the cervical posterior, which I'm not feeling any swelling, any abnormalities, or anything like that within those areas. So he is all good there. Okay, and then finally we're going to go into his cardiovascular section. So again, we're just palpating around to make sure that there's no unusual masses. Looking for your apex and the base, and I'm not feeling anything. And then I'm going to listen to his heart sounds, and we're going to go, the usual, it's 8 to man, apical, tricuspid, apical, pulmonary, tricuspid, and then, I apologize, I'm having a brain fart. Mitral valve. So we're going to take a listen to that. And around your mitral area is also your PMI, which is your maximum intensity. Now I'm going to do this listening with the bell of my stethoscope. Okay, which all of his heart tones sound really good. So, and that concludes my assessment from his head to his chest area. Again, my name is Michelle Morgan. Thank you very much, and I'm going to do my hand sanitation again.